Well, hello and a very good morning to all of you on a beautiful midweek day. Yes, it is a Wednesday and you are watching Good Morning Sri Lanka. Tuned into MTV Sports with me, Wissam Ismail, and we've got an exciting show for you this morning. We're actually going to tap into different forms of unconventional forms of healing. Yes, we're going to be talking about hypnotherapy, we're going to be talking about stone healing therapy, as well as something you may have heard of, which is Reiki. So this morning we're going to first start off with Reiki, and what's really exciting is that we have some live demonstrations when we are going to take you through each and every topic. So as usual here in Good Morning Sri Lanka, we have the experts with you to talk to you about these things and to introduce to you our first guests for this morning. Let me introduce Dr. Loretta Shamini Durai Raja, who has a doctorate in hypnotherapy, and she is the director and alternative and complementary therapist from the Divinity Wellbeing Center and Academy, and she is here with her friend Chaturika, who has also been using Reiki as a treatment form. So good morning to both of you, and thank you for joining us here on Good Morning Sri Lanka.
Thank you.
It's very nice to be here with you guys.
Yeah.
So I know you don't like me calling you doctor, but I'm going to be calling you doctor this
Call
morning.
me Loretta.
Okay, fine. So then that is what I'll be calling you this morning, Loretta. Please tell our viewers what Reiki is about. What is Reiki?
Okay, Reiki is a subtle, soothing energy. Reiki is actually a Japanese word. So if you got to translate it in English, it's universal life force energy. That's Reiki actually. And how do you receive Reiki, if you want to know? Well, if you go to learn Reiki, the Reiki master, the one who teaches you Reiki, will attune you to receive this energy. As a student, you will receive this energy, you'll be attuned to it, and you will have this energy in your hands. So when you want to give this energy to someone, you make an intention that you want to give Reiki to this person or this patient, and you place your hands on certain points on that person's body and you give Reiki.
So what you're saying is Reiki is something that originated in Japan.
Yes, it is.
And it's a Japanese form of healing, and if anybody really here wants to really understand and learn how to use it, what are their options here?
Well, if they want to use it, they can go to a Reiki therapist who does Reiki for them. And if you want to learn, you need to go to a Reiki master, like if you're curious to be a Reiki practitioner.
And to be a Reiki master or to use Reiki to help somebody, do you need to have a doctorate?
No, you don't need.
You don't. So it's something that can be learned, understood, and then...
There are certain levels that you need to complete to become a Reiki master. But to do a Reiki practitioner, there are 2 levels. And so if you complete those levels, you can be a Reiki practitioner.
I see. So I understand later on you'll be doing a demonstration to us this morning with Good Morning Sri Lanka.
Yeah, sure.
And you'll be using the help of Chaturika to be doing so. And before I do ask more questions from her, I need to ask you, what made you get into Reiki?
I've tried different types of treatment, and I wanted to give it a try, which I've learned it was a good try.
So what you're saying is you got a really positive experience from it. Do you think it actually helped you?
Yes, it has.
And you recommend it?
Very much, yes.
I see. Great. So tell us, what kinds of things would Reiki help us with?
Any emotional issues, for example, relationship, marriage, career, health, anything of that sort.
I see. So what you're talking about is a more psychological aspect of it.
Yes.
What if you take a more physiological aspect of it?
See, they say that 99% of your physical issue arise from an emotional reason. So for example, you're suffering from high blood pressure. Probably you've been suppressing some kind of stress over the years or over the few months. So you've been suppressing it for a while, and it burst out as a disease. So we go back and treat those diseases. What happened to you? What made you to get these diseases?
I see, I see. So what you're saying is you can use this as an effective psychological treatment, and in other words, doing so will help all your physical problems as well. So I mean, usually if you go to a psychologist or a psychotherapist, psychiatrist, they will basically talk to you, try to understand what your problems are. Then they would even prescribe you, a psychiatrist would prescribe you with medication they would think which is necessary. So in this case, is there any additional medicine that's needed?
No, not at all. That's the highlight of these holistic or alternative or complementary therapy, even Reiki or theta healing or emotional freedom techniques that I practice, does not require any kind of medicine. So that's why it comes under alternative and complementary therapy.
I see.
So even if you are, for example, you're taking, going to a doctor, taking some medication, this can add as it will enhance your process, like if you're taking any of these treatments.
I see. And in a psychological aspect, Lloyd, if I'm to say, I mean, usually psychiatrists or psychologists, they take this approach of, talking to you, trying to understand what your problem is. So is there any sort of counseling going on before performing Reiki as well?
Definitely. So when someone comes, you need to talk to them what made them have this problem. Maybe it's financial problem or career or relationship. So everyone has their own story. So we want to know what that story is. What is that root cause of this problem? So we believe, like in alternative practice, we believe there's always a beliefs or a fear or a thought process that derived you or forced you to come to this place.
I see.
So your experience you face is your beliefs that leading you towards that experience.
I see.
So we treat that beliefs or the thought process or that fear that you're holding on to.
I see. And what is the opinion when it comes to Reiki, when it comes to traditional forms of people who practice psychological issues with, like, for example, a psychiatrist? If you take a normal conventional psychiatrist, do they believe in this form of Reiki? Do they have anything against it? Because I know for a fact that recently I spoke to a psychiatrist who said that he completely doesn't believe in the form of hypnotherapy. That he basically said that science can't prove it, medicine can't prove it. There's no such thing.
Actually, I don't know why he said that, because actually if you go in the medical board, hypnotherapy, Reiki all comes under alternative medicine. It comes under the medical board of dental and medicine. So if you go in, just go and check in the Indian Board of Medicine from Calcutta, you will see this under alternative medicine, hypnotherapy and Reiki and all those.
And what is the following like here in Sri Lanka?
They're quite open to it. Actually, I had really good clients, patients coming in, and they're open towards it because probably they would have tried all the other methods and probably didn't work, so they come to me and they're seeing some positive results.
I see. Well, there you go. And what about things that you can get done with Reiki? I'm sure, it is an unconventional form here in Sri Lanka. Not many people know about it. So now, when it comes to something like hypnotherapy, I know you have a doctorate in hypnotherapy, and later on we have a session on hypnotherapy as well. And sometimes people are afraid to try out hypnotherapy because they think that you can, the person who's doing it can actually mess with your brain. So we're going to find out about that later on. But how is it in terms of Reiki?
No, you can't mess up with that, with your brain or anything, because it's a subtle and a very gentle healing method where you can even give to a newborn child, a pregnant person, pregnant lady. So it's a very soothing and very calm energy. It works according to that person.
I see. And any side effects?
No side effects.
No side effects at all?
Like you'll feel a little bit, once you're done the session, you'll feel like a little bit sleepy or drowsy, but that because it's so soothing, you feel like, oh, I'm in another world.
I see.
So you will have a glass of water and just ground yourself, you'll be just fine.
And if I'm not mistaken, what I've been told is now Reiki is a form of mind relaxation as well. It's a mind relaxation technique.
It is.
And I'm being made aware that you follow a few other techniques as well. Would you like to talk about that?
Okay, so mind relaxation technique, just not only Reiki. There is another technique called theta healing and emotional freedom technique. In short, you can call EFT.
EFT.
Emotional freedom technique.
So do you use this all together, or is it like three different
like you said,
practices all together?
Yes, like you said that some people are scared of hypnotherapy. They have this weird psychological idea about this, maybe someone mess up their brain or something. So these techniques like emotional freedom technique or theta healing, it's like an option. If they're scared, they can use this.
I see. So Chaturika, did you know about this or everything we've been talking about? Did you know that before you went into it?
Not
exactly, but then when I went into it, I got to know about it, and I didn't have a problem with it.
I see. Well, thanks for being with us this morning. I know we're going to use you for a demonstration.
It's my pleasure.
And here in Good Morning Sri Lanka, we're going to give you a live demonstration on performing Reiki. But of course, Dr. Loretta here told us basically that she takes at least about half an hour to 1 hour per session, but unfortunately we don't have the freedom of giving that amount of time. So we're going to see if we can do a little fast forward version of it and maybe show you a slight demonstration for about 3 to 5 minutes. So let's get on to it. So we're going to set up and we're going to go in for a short break until we do so. So hang around.